Hello and welcome to Burgess Plastic Surgery. I'm Dr. Elisa Burgess. I'm a board-certified plastic surgeon in the Portland metropolitan area. Today, our focus will be on breast augmentation. And breast augmentation can be done alone or it can be done with a breast lift as well. Just really kind of depends on the position of your nipples. Sometimes if the nipples are too low, we have to centralize and bring them up. But today, our focus will be on breast augmentation alone. It's one of the most simplest surgeries, but the most complex surgeries at the same time. And part of it has to do with the sizing and trying to get inside your mind and figure out what size you envision you would like to be. Sometimes we ask people what cup size you think you are and what your goal is. And we can't actually guarantee a specific cup size, but we're just trying to get inside your mind and see what you envision. Because bra manufacturers don't really standardize what cup size is. So a C cup in one brand may be different than another brand. And it also depends on how much tissue you're starting with as well. So if you add an implant and you have a lot of tissue, your cup size is going to be bigger. For breast augmentation, it's typically a 1-hour surgery. We are definitely trending towards using an internal bra as well. This is a resorbable mesh to kind of cup and hold the implant in position longer. It's nice because I think for particularly thin patients that don't have a lot of breast tissue or breast support, that it can be a game changer for those patients long term. So for breast augmentation, we typically make incisions underneath the breast. And so the incision is typically underneath here. You can go around the areola, but that can interrupt the milk ducts. And you can also go underneath the armpit, but that can interrupt the lymphatics. So the preferable way is to actually make an incision underneath the breast. There are different positions that you can put implants in. The most popular one is actually underneath the muscle. You can also go underneath the fascia, which is the layer that's on top of the muscle, or totally on top of the muscle, and we call that subglandular. The most direct route to this implant underneath the muscle is through that fold, and that's the incision that I showed you before. When you put the implant under the muscle or under the fascia, you're kind of having a support system for that implant. When you put it on top of the muscle, that tissue can sag over time, especially as women age. So I am not fond of putting the implants on top of the muscle. Sometimes we will, when we're doing revision surgery, if they already have a pocket there, then we may consider putting it on top of the muscle. Now let's spend a little time talking about breast implants. In the big picture, there's saline and silicone implants. There's all different styles, all different companies. I wanted to tell you a little bit about the saline breast implant. We use this one, but not as much anymore. Great implant. I've been using this one for years. Basically, it has an outer silicone shell and the inside is saline or salt water. It has this little valve here. We actually put it in and then we fill it once it's inside. But again, you choose your size in advance. If you have a leak or rupture with this implant, it essentially just goes flat, like not a big deal. It's hard to know how long your implant could last. It could be 10 years, 20 years, 30 years, but these implants I think are very durable. The other big category is silicone. I'm going to show you a 4th generation silicone gel implant. We don't really use these ones anymore. Still great implants, but you can see kind of how soft it is and it's rather floppy. With silicone implants, it's recommended that you get a breast ultrasound, known in our clinic as a high resolution ultrasound. And we can just swipe about every 5 years or so looking for a silent leak or rupture. So very, very simple. Or the other thing that the FDA recommends beyond an ultrasound would be an MRI. But I want you to see what these gummy bear implants, these are the 5th generation silicone implants. Still very soft, very durable, but hold their shape and structure just a little bit more. So if you cut open this implant, it just sits there kind of like the candy, the gummy bear. Really great implants. And again, all different companies for silicone implants. The newest implant on the market is the Motiva implant, and this is considered to be biocompatible. It has this not truly texturing, but kind of like a microsurface. It's a 4-micron microsurface to it. That really a very nice implant as well. So I just wanted to show you one of my patients from many years ago. You can see she has some breast asymmetry, and we all have breast asymmetry, very important. Right after surgery, things are big and swollen. Here she is a year out after surgery, and here she is almost 10 years out after surgery. So these implants are still in the same position. It's just that her tan lines have changed. The one thing for very thin patients that have very little breast tissue, sometimes a internal bra can be really helpful. This is a resorbable mesh. It's not FDA approved for the breast. It's FDA approved for soft tissue support. You can put the implant in, it can cup and support and hold the tissue up. One other thing I wanted to show you is Chryslix. Chryslix is our 3D imaging system. I think it's really helpful for women to decide in advance what size they would like to be. We can use this 3D imaging. We can figure out from this three-dimensional kind of photograph of you and then try on different sizes of implants. So you can try a 300cc implant, a 400cc implant, and really get an idea about what you might look like after surgery. So we do traditional sizing as well, but I think the 3D is really helpful. We've put a bathing suit on this model, but you can see that this can be really helpful as well. So you can try on different sizes, and I think it's really helpful for patients to be able to understand that. The best thing to do for breast augmentation consult is to make an in-person consultation where we can examine you. We can do breast measurements. We can figure out your goals. We can figure out nipple position, because sometimes for patients that have really low nipples, if I put the implant up here, then it won't really work because you have to centralize the nipples. And sometimes that involves doing a mastopexy or breast lift. And that does have a little bit of additional scarring, but it looks so much better. In addition, we'll do a breast exam. If you're less than 30 years of age, then you don't need to do a mammogram, but many of our ladies are also over that age and we'd like to do a mammogram. Then we do breast sizing, we do the Chryslix, and then try to help guide you to make a decision about implant company, implant style, and implant size. So if you have any other questions, please join us at burgessplasticsurgery.com.